Welcome to AETCM, the emergency medicine channel. So all aware we started the endocrine emergency series. Last 3 presentation we discussed regarding the diabetic emergency. So in upcoming 2 presentation we'll see regarding the thyroid related emergency. So that is hypothyroidism and then hyperthyroidism. So in this presentation mainly we are focusing on the hypothyroidism. So before getting into the hypothyroidism, we'll see some flash note regarding the anatomy of the thyroid gland. So as like we told thyroid, we know thyroid is one of the gland that comes under the endocrine system. So endocrine gland. So it is butterfly shaped one and then it exactly situated in your neck, or if you want to particulate the area means, so it is inferior to your cricoid cartilage. So again it have a two lobes like a right lobe and then left lobe. So both lobes are connected by your isthmus. In a midline it is connected by an isthmus. So and then again the thyroid gland it will secrete the T3 and then T4 calcitonin hormone. So three major important hormone are secretion, that is T3, or you can call as a triiodothyronine, T4 or tetraiodothyronine or thyroxine, and then we one more secretion or hormone, that is your calcitonin. So what is the function for the thyroid hormone? So mainly it will take a role in the growth and then metabolism related. So growth means, so each irrespective of organ and then system, each cell need a thyroid hormone to develop. For their own development it need a thyroid hormone. And then second important thing, it will regulate the metabolism, means carbohydrate metabolism, fat metabolism, protein metabolism, that thyroid hormone will regulate. And then one more important thing, so what we will get so through metabolism we will get heat as a byproduct, right? So again the thyroid hormone will take a role in the thermoregulation also. So that is the three major important thing. First one, it will your aid function in the growth related and then metabolism related and then thermoregulation. So thermoregulation, that is controlled by, or that is related with your metabolism related. So if high metabolic rate is there means there will be a high temperature. If low metabolic rate is there means there is a low temperature will be there. So it is a indirectly connected. So that is thyroid is indirectly it is controlling. And then one more important thing, it will regulate the action of, or it will modify the action of heart and then respiratory related things. So again it will increase the heart rate, it can reduce the heart rate, tachycardia, bradycardia, and then tachypnea, bradypnea chances are there. So based on the relative with your thyroid secretion. So if it is a hyperthyroidism means there is a excess amount of thyroid hormone, thereby it will increase the heart rate, tachycardia will be there. And then if there is a low amount of secretion or hypothyroidism means there will be a lesser amount of thyroid hormone, that it leads to it will reduce the metabolic rate, and then again it will lead to the bradycardia related things. So those are the some various functions of your thyroid hormone. One more important thing, we have a secretion of calcitonin, or we have a hormone of calcitonin. That calcitonin will take a role in the regulation of calcium level, serum calcium level. So it will regulate the metabolism, it will regulate the reabsorption related things. Okay. So this is regarding the anatomy. And then regulation of thyroid hormone, how your body will regulate the thyroid hormone. So one mechanism is there that called the negative feedback mechanism. Negative feedback mechanism means what? Means, so you just remember the negative feedback mechanism statement, I will explain one by one. So here if you want to understand this concept mean, you should remember the three major parts. First one, you should remember the hypothalamus. Second one, that is the anterior pituitary gland. Third one is the thyroid gland. So how the body will secrete the thyroid hormone, we'll see first. First, if there is any need for the thyroid gland, or there is a excessive need, or there is a increased amount of thyroid hormone needed for your body means, that the time your body will raise a request to your hypothalamus. Okay. So at the time of need, your body will raise a request to the hypothalamus. Means need in the sense, if your body in the hypothermia, or if your body need for the metabolism related things, if body need a some thyroid hormone, there it will raise a request to your hypothalamus. So at the time of need. Okay, so the hypothalamus receive the message and then it will send one messenger to your anterior pituitary gland. So here the hypothalamus itself directly it can't stimulate your thyroid gland, or directly it can't interact with your thyroid gland, thereby so your hypothalamus will send a messenger to your anterior pituitary gland. So pituitary gland we have a two parts, right? Anterior and then posterior. So it will send a request to your anterior pituitary gland. So that messenger name is from hypothalamus anterior pituitary gland. There one messenger will come. The messenger name is TRH, thyrotropic releasing hormone. Okay, so the thyrotropic releasing hormone come and they will share the message of there is a need for the thyroid hormone, and then that anterior pituitary now he will send a one more messenger to the thyroid gland, that name is TSH, thyroid stimulating hormone. Okay, so in the time of need it will secrete more amount of TSH, so that will secrete and then that will release into your circulation. That messenger they will come and attach with your thyroid gland, it will stimulate your thyroid gland, thereby your body or thereby your thyroid gland will secrete the thyroid hormone. So this is the pathway. First, whenever your body need a thyroid hormone, it will raise a request to your hypothalamus. Hypothalamus directly it can't interact with your thyroid gland, so that's why it is communicating with your anterior pituitary gland via the TRH hormone, and then again the message will received by your anterior pituitary. Again the anterior pituitary will send some messenger, their name is TSH, thyroid stimulating hormone. The thyroid stimulating hormone they will go and stimulate your thyroid gland, thereby you will get a secretion. Okay, thyroid your hormones, that is a secretion. So this is the pathway that will occur in the hypothyroidism. So there will be a reduced thyroid secretion. So in a easy term I can summarize like this. So there is a decreased thyroid hormone. So to that your request will go to the hypothalamus and then anterior pituitary, and then that is increasing your TSH level. There is a increased release of TSH level. Because of that it will go and attach your thyroid gland, thereby you will get a secretions, thyroid hormone, right? So that is, so here you can see the both are opposite direction, right? That's why we told the negative feedback mechanism. There is a reduced thyroid hormone level, then the time your body is requesting help, there is a increased TSH level, that increased TSH is attaching your thyroid gland, thereby the secretion is there. So vice versa, if your body have a more amount of thyroid secretion, means that your body will suppress the TSH release. Okay, there you can see the suppression in the TSH level, that will happen in the hyperthyroidism, or instead of telling the hyperthyroidism, there is a increased level of thyroid hormone. So in the term we can use. So this is the way your body will regulate your thyroid hormones, that is called the negative feedback mechanism. Okay, if low level of thyroid hormone means there is a high level of TSH, there is a high level of thyroid hormone means there is a low level of TSH hormone. So you have to remember this concept. So whenever you are going to interrupt regarding the related with a thyroid related disorder, means the first ideal thing you have to see the TSH value. So by seeing the TSH value itself, you can identify whether the hypothyroidism or hyperthyroidism. In hypothyroidism, there will be increased TSH level. In hyperthyroidism, there will be a decreased TSH level. And then again, still you want to confirm that condition, means you can check the T3, T4 level also. Okay. So these are the normal values. And then thyroid disorders. So in hypothyroidism, mainly we have a Hashimoto's disease and then myxedema cretinism. In this, myxedema coma is a most important emergency. So hyperthyroidism is Graves' disease and then thyrotoxicosis. So here we are going to focus only the hypothyroidism. So hypothyroidism means what? There is a decreased production, or there is a decreased secretion, or there is a decreased circulation of circulating thyroid hormone, that is a hypothyroidism. Mainly Here we told the functions wise, we told it will regulate the growth and metabolism, it will take a role in the calcium metabolism and then absorption, it will take a role in the heart rate and then respiratory related things, right? In a hypothyroidism, what will happen? All things will go low. So your body will slows the metabolism, there will be a reduced metabolism will be there, heart rate, respiratory rate will be low in state. So those are the consequences that will arise in the hypothyroidism. Mainly we have two types, primary hypothyroidism and then secondary hypothyroidism. What is mean by primary hypothyroidism means the problem primarily will be in your thyroid gland itself. So the pathology will be in your thyroid itself. Secondary means that is a extra thyroid causes, means there you have a intact thyroid function, but there will be a problem in the either pituitary gland or there will be a problem in your hypothalamus. So those are the things will comes under the secondary and then primary. Primary we told there will be a problem in your thyroid itself. So the condition like Hashimoto's thyroiditis, that is one of the autoimmune disease, and then iodine deficiency. So iodine you should remember, iodine is one of the major important element that will take a role in your synthesis of thyroid hormone. So again, so if iodine deficiency is there means less amount of iodine that won't participate, or there will be a less amount of production in the thyroid hormone. So iodine is one of the important factor. And then congenital causes or any infiltrative, or if the person is taking any anti-thyroid drugs, like in hyperthyroidism we will give some anti-thyroid drugs. So if the person in any anti-thyroid drug also, that can cause the hypothyroidism. So these are the things will comes under the causes for the primary. Secondary, it is one of the rare condition, but secondary the causes, as like we told, there will be a problem in your either that is a problem in your pituitary gland or in the hypothalamus gland. So that there will be a TSH deficiency or TRS deficiency, those are things will arise. So, and then first condition is in hypothyroidism, Hashimoto's disease. So, Hashimoto's disease means it is one of the autoimmune condition, means your body will secrete first, before that Hashimoto's disease, first the person will develop the Graves disease, means the Graves disease is one of the condition that will comes under the hyperthyroidism. Let me explain one by one. First thing, whenever first your body will secrete some of the auto antibody that will go and attach your TSH receptor. So your body will secrete some antibody, it will go and attach your TSH receptor. Thereby it will increase the secretion of thyroid hormones. First stage, initially there will be a increased secretion, means there will be a hyperthyroidism. In a days goes, so if you are not treating this condition means after some times or after some days it will enter into the hypothyroidism. The condition is called Hashimoto's disease. So initially there will be an autoantibody that will attach your TSH receptor, thereby your body will secrete more amount of thyroid hormone. This condition is called Graves disease, Graves, Graves disease, Graves disease. So once if you are not treating the condition means after some times or after some days it will go into the hypothyroidism. That condition is called Hashimoto's disease. So this is the things regarding the Hashimoto's. Cretinism in the sense it is from the birth, hypothyroidism from the birth. So the causes wise again here also Hashimoto's disease, iodine deficiency, or if the maternal goes under any radiation therapy, anti-thyroid drugs means that can cause the cretinism. And then myxedema coma, so this is the one of the important life-threatening emergency we have to remember. So it is myxedema coma is defined as a severe hypothyroidism that leading to the decreased mental status, hypothermia, and then other symptoms related with a multiple organ dysfunction. So you remember the normal function of the thyroid gland, thereby you can easily remember the what are the things will arise. So clinical feature wise, so the same thing only. So you can see that goiter or you can see the enlarged thyroid gland. There will be a loss of eyebrow and then eye hair. Thin hair will be there, puffy face will be there, slow heart rate, bradycardia will be there, and then there will be a hypoventilation will be there because of that irregular. Sorry, there is a low respiratory rate, right? Because of that you will get a hypoventilation syndrome. Hypoventilation will be there. So because of hypoventilation, what are the things will arise? There will be a hypoxia will be one consequence. Second thing is there is a buildup of carbon dioxide, means respiratory acidosis chances also there. And then poor appetite, constipation because of the low motility of your gut or your intestine, that leads to the constipation related things. Infertility, heavy menstruation will be there. Here you can see the weight gain because of the there is a problem in the water regulation. So your body will retain the more amount of water, that leads to the weight gain will be there. One more important reason or reason for your weight gain, that is here in hypothyroidism there will be a reduced metabolism, right? So whatever we are having, that will without if the metabolism happen once, I mean it can convert into the ATP, glucose, whatever it wants. But if the metabolism is not occurring, means so whatever we are eating, that will stagnant in your body, and then that will also cause the weight gain. So those are the two reasons for the weight gain. And then cold extremities in hypothyroidism, mainly there will be an cold intolerance will be there, because there is a reduced metabolism. So if reduced metabolism means there won't be any byproduct of heat, so the body automatically will go into the hypothermia. So these are the again clinical features: lethargy, stupors, convulsion, hypotension will be there. Hypoglycemia, again it is metabolism related. Because of the reduced metabolism, the person will develop the hypoglycemia. So again, if you found the hypoglycemia, then under we have to treat the condition. Hypoventilation, this is also because of the shallow respiration. So here the two consequences we told, right? First one is a hypoxia the person, and then second is a respiratory acidosis, or there will be a hypercarbia. And then hyponatremia, this is also because of the fluid retention. There will be excess solvent level, so solute level will go low, so that is leads to the hyponatremia. And then investigation wise, so you have to remember that negative feedback mechanism. So hypothyroidism, there will be increased TSH level, there will be a suppressed or there will be a reduced T3 T4 level. So electrolytes also you can check osmolarity, creatinine, glucose level, and then differential blood count. ECG you can see the Osborn waves or Osborn J waves. So I'll explain in the next slide. And then radioactive iodine uptake test. So this is also one of the tests we will do in a definitive care we will do. In pre-hospital we don't have the privilege to do. So a radioactive iodine uptake test means it is one of the, in other name we will call as there is a scintigraphy, okay, thyroid scintigraphy, SCINTA scintigraphy, GRAPHY, scintigraphy, thyroid scintigraphy. It is one of the nuclear study. So it is nothing but it is a iodine, right? So we will give iodine. So either in a syrup format or in a tablet format. We will ask the person to take iodine tablet or syrup. So after 6 hours, or some other institution they will follow after 24 hours, we will do the some scanning, some nuclear study will do. Thereby we will identify the absorbed there is absorbed or retained iodine level in the thyroid gland. So that is the way we will interpret. So interpretation wise is nothing but so if you are doing in a 6-hour manner means, so sometimes, so the interpretation first thing the radiology people itself they will give a interpretation, means they will based on that area of absorption they will give an idea by seeing the picture. Or one more method, that is based on your absorption rate or thyroid retention, iodine retention rate. So if you are doing 6th hourly means there will be a value regarding the 3 to 16%. So this is the normal thyroid iodine uptake. So if you are giving iodine means that will absorbed by your thyroid gland, that iodine will use for your thyroid hormones production, right? So if the 3 to 16% iodine uptake by your thyroid gland is there means that is the normal thing. If it is going less than 3% means that is indicating the hypothyroidism. If it is the body is uptaking more than 16% or ideally more than 20 or 35% means that is indicating the hyperthyroidism. And then some institution they will follow the 24 hours protocol. So 24 hours after ingestion of your iodine, today if you are means let me say 12 o'clock if you are giving means tomorrow 12 o'clock if you check the level, means there it will be like a 8 to 25 percentage. Okay, so if it is going less than 8 percentage means that is hypothyroidism. If it is going more than 25 percentage means that is hyperthyroidism. So this is the way they will interrupt the radioactive iodine uptake test, mainly just to have an idea. These are the things they will carry out by the in-hospital, and then mainly in in-hospital also we won't rule out, that is fully they will radiology side they will take it. So just to understand the concept I am telling. So and then one more important, most important thing we can identify in hypothyroidism, that is a ECG, Osborn J wave. So Osborn J wave is nothing but, so in normal ECG how it will be, so you will see the P wave and then QRS wave and then T wave, right? So P and then QRS, you will get a T wave. So this point is your J point, right? So here you have a negative pattern, right? But in your Osborn J wave, there will be a positive pattern. Means how it will be, means you will get a P wave, QRS, and then there will be a positive J wave, means it will be like this. Okay, so the positive J wave and then you will get a T wave. So here you can see the exactly, so V2, V3, so there is a positive deflection of your J point, that is Osborn J wave. Okay, so this thing mainly Osborn J wave we can see in the precordial leads. So V2, V3, V4, V4, V5, V6, there we can see the predominantly in a precordial leads you can see the Osborn J wave. So this is the one of the factor which we can use in the pre-hospital itself. Mainly that Osborn J wave will arise in the case of hypothermia only. Okay, so those are the some clinical assessment point you can remember. So finally management wise, so in pre-hospital what are the things we have to manage? So first thing, mental status related. So the person presentation, mental status presentation will vary from the according to the condition or according to the severity of the disease. Either the person sometimes they will present with an, they will awake and then they will alert, they will orient with you. In that condition you have to frequently assess and then you have to manage the condition. But if the person went into the, they are only responding with an voice or they are only responding with an pain, means you have to think about the airway related threats. So whenever the person get a collapse and then whenever they can go for the airway compromise, that cases you have to think for the airway urgence. And then one more important thing, there is a unresponsive state. Their ideal choices, ideally you have to, or definitely you have to go with some definitive airway or airway agents like oropharyngeal airway. So these are the things regarding the airway and then mental status. So AVPU, awakened and alert cases, you have to frequently reassess the condition and then you have to control the symptomatic related treatment. VNP, so if the person only responding with a voice or pain, means there you have to think or there you have to anticipate the airway related threats. And then last category, there is an unresponsive state. Ideally or definitely you have to go with an airway management. Either you can go with an airway agent. So if the condition is more severe, means you can go with an definitive airway. So this is regarding the airway and then breathing related. And then here a second most important challenge here what we have means, that is a hypothermia. So hypothermia, ideally you have to cover with a blanket. If you are crew with air conditioner, means you have to turn off the your air conditioner, and then you have to if you are going to infuse the fluid, means it should be in a warm fluid you have to infuse. And then you have to think about the some temperature regulatory manners and all we have to take in care. So that is the thing regarding the hypothermia management. Third thing, if the person is hypoglycemia, means there you have to treat with an 25 percentage dextrose. So again you have to rule out whether the person is less than 60 percentage of, sorry, less than 60 milligram per deciliter. You have to do with a field glucose test glucometer. Then if you found the person is hypoglycemia, means you have to ideally replace the 25 grams of IV parenteral, your IV dextrose containing solution. And then other important thing we told regarding the heart rate related things, right? There will be a bradycardia. So if you found symptomatic bradycardia, means ideal choices you have to go with an injection atropine 1 mg you have to give, maximum of 3 mg. So that is regarding the bradycardia. And then coming to a respiratory system, there we told regarding the hypoventilation. Because of that, we told two consequences. First one, hypoxia. If the person in hypoxia, you have to administer the supplemental oxygen. If the person have a respiratory acidosis, if it is a severe respiratory acidosis, means pH is less than 7.1, HCO3 going less than 10 or 15, means there you can go with an soda bicarbonate. Until otherwise, you can go with a supplemental oxygen. So based on the severity, we can treat the condition later. So this is regarding the symptomatic management in the pre-hospital. First, I told regarding the temperature. Second, I told first we started with the mental status and then airway threats. And then second, we told regarding the hypoglycemia. Third, we told regarding your heart rate related things. Fourth, we told regarding the hypoventilation. So these are the things we will do in the pre-hospital side. In hospital wise, so here we will get a clear cut picture. So we will through the lab values, everything, we will get a what are the problems the person have. Based on that, we will treat. So again, if the person have a carbia or hypoxia, means we will treat. And then mental status, again the same thing only. Again, if the person is hypoventilation, we have to give the crystallite therapy. Here we have to replace or we have to supplement the thyroid hormone. That is the next thing. So ideally, that loading dose, because myxedema coma, right? So here we are going to give a supplementation of thyroid hormone. That loading dose will be like a 500 to 800 micrograms we have to give initially per oral dose. Then followed by ideally daily dose calculation, it will be like a 1 to 1.5 micrograms per kg. So that is the ideal dose for the daily dose of thyroid hormone replacement. So initially, if the person present with a myxedema coma, means initial dose is 500 to 800 micrograms you have to give. And then after that, for daily dose calculation, you have to give the 1 to 1.5 micrograms per kg. Based on the kilogram weight, we have to set the dose range. So that is regarding the replacement of or supplementation of thyroid hormone. So here main route is peroral route. Still as of now, we have only peroral route only we don't have any parenteral route. So ideally we have to replace with an oral route. So these are the things, management related things. So do your best. Shalom.